the abdominal cavity on the posterior abdominal wall against the T12 to L3 vertebra. Tell me the anatomical position of kidney. It lies in the paravertebral gutter, and paravertebral gutter is like this. So anterior surface faces laterally. It should be like, we can't hold like this. If examiner will ask you, hold in anatomical position, then you cannot hold like this. You have to hold like this, that anterior surface faces laterally. And this is superior pole and this is inferior pole of the kidney. Superior pole is somewhat medially and backward. Like this. Like this. Okay? दो बहुत ज़्यादा हो जाए. एक थोड़ा लंबा, एक थोड़ा छोटा. Look, here is the left kidney and this man with the apron is right kidney because it is at lower level due to the liver.
भाई
anterior surface should face laterally, superior pole should be medially and backward, somewhat backward. पीछे करके लोग नहीं सुनता है तो थोड़ा सा पीछे जाता है और medially, है ना? Such that if there is midline, this one is the midline. The superior pole 2.5 centimeter, hilum 5 centimeter, and inferior pole 7.5 centimeter from the midline. Such that this is the anatomical position. As this kidney lies in the paravertebral gutter, that's why anterior surface faces laterally, and superior pole is somewhat approximated, that is medially and backward. Okay? Such that from midline it is 2.5 centimeter, at the level of hilum it is 5 centimeter, and the inferior pole is 7.5 centimeter. ठीक है? तो anatomical position अच्छे से समझ गए और कभी भूलोगे भी नहीं, है ना? Now the examiner will ask you, please tell me of which side it belongs to. So the surface which is convex should face anteriorly and flat surface should face backward. So this is anterior and this is posterior. Okay? Laterally there is convexity due to the lateral border, and medially there is concavity due to the presence of hilum. So this is lateral and this is medial. I can't hold like this. Okay? And in the hilum, most posteriorly is the pelvis. This is renal pelvis. The extension of which after the inferior pole of the kidney is said to be as ureter. It is termed as ureter. Up to the inferior pole, its name is renal pelvis. Okay? So, when we look at the structures of hilum, most posteriorly is the ureter or renal pelvis, and it should go untwisted downward. अगर हम लोग ऐसे पकड़ लेते हैं तो भी वो नीचे जा रहा है, लेकिन twisted. इसमें भी anterior है, medial है, lateral है, वही चीज है. लेकिन superior inferior का तभी होगा कि when we look about the site determination. Now examiner will ask you what are the structures at the hilum. Hilum of kidney. It is valve. That first there is renal vein, then artery. This one is artery. You can appreciate this small opening from which water is oozing out. This is artery. This is vein, and this is renal pelvis. Valve. From anterior to posterior, it is valve. Now the examiner will ask you, tell me about the covering of kidney. From exterior to interior. No, I will go from interior to exterior. Interior to exterior, it is first there is true capsule, then comes perirenal fat, then comes renal fossa, and most exterior is the pararenal fat bodies. What are the covering? From inside out, it is the true capsule, then comes perirenal fat, then comes renal fossa, and then pararenal fat body. Okay, now tell me a peculiar thing about the renal fossa. How it is the pattern of arrangement. So you have to say renal fossa covers kidney by bilaminar fashion, that it has got anterior lamina and posterior lamina. Anterior lamina is also known as fossa of Toldut, T-O-L-D-T, fossa of Toldut, and posterior lamina is also known as fossa of Zucker-Kandel, Z-U-C-K-E-R-K-A-N-D-L, Zucker-Kandel. Okay, after the name of the scientist, fossa of Toldut and fossa of Zucker-Kandel. Laterally, these two fossa unite and blend with the fossa transversalis. Behind, this posterior lamina intermingle with the psoas fossa, that is fossa over the psoas major muscle. Psoas fossa, posteriorly it intermingle. And above, these two lamina unite and then again diverge to enclose the suprarenal gland. First it unite and then again separate to enclose the suprarenal gland which sits over the top of the kidney, we all know, and then again it close. And now this, after the closure, it is named as conal fossa. Conal fossa, which intermingle with the inner surface of the diaphragm, where the diaphragmatic fossa lies. So conal fossa will intermingle with the diaphragmatic fossa. This is the peculiar arrangement, and one thing very important, that below this anterior lamina and posterior lamina is not attached, and it is only supported by pararenal fat bodies, the fourth layer, most exterior one, pararenal fat bodies. Very important. Now the examiner will ask you, why kidney moves with the respiration? Because we have discussed here that the both lamina unite, both lamina of renal fossa unite here, then enclose suprarenal gland, then unite to form conal fossa, which intermingle with the diaphragmatic fossa. So when diaphragm moves with the respiration, this kidney also moves. Okay. Now the examiner will ask you, what is nephroptosis? Descent of kidney. Descent of kidney, as both fossa, anterior lamina and posterior lamina, is not attached inferiorly. It is only supported by the pararenal fat bodies. So in case of starvation, this fat body used up by the body and descent of kidney occur. In case of starvation, prolonged starvation. Now tell me, what is actually, how will you define nephroptosis? So descent of kidney of 2 vertebral level or 5 centimeter below. 5 centimeter below or 2 vertebral level when a person stand up from a supine position. अगर लेटा हुआ है, खड़ा हो जाए और 2 वर्टिब्रा लेवल नीचे चला गया किडनी, या नहीं तो 5 सेंटीमीटर, then it is termed as nephroptosis. Okay? Now, the examiner will ask you, tell me about the segment of kidney, vascular segment. So, it has got 5 vascular segments. This is apical, this is caudal. Now, this much is left on the anterior surface. Again divided anterior superior, anterior inferior, and posteriorly this much is posterior. This much is apical, this much is caudal, anterior superior, anterior inferior, and this one is posterior. So 5 vascular segments. That's why there is 5 segmental vein. Okay?
क्या बोलिए 5 सेगमेंट है
कुछ कट करने का ना ना. Now the examiner will ask you, this is, what is this? So this is ureter. After the inferior pole, it is renamed as ureter. Tell me about the constriction of ureter. Very important. Constriction of ureter. So, at the pelvic-ureteric junction, there are 3 constriction, main constriction. At the pelvic-ureteric junction, where it is pelvis and below is the ureter. Pelvic-ureteric junction. Second, when it crosses the pelvic brim. Pelvic brim of hip bone, heart shape. Pelvic brim, where it crosses pelvic brim. And third, intramural part, when it invaginates the substance of urinary bladder, the muscles of urinary bladder, intramural part. Okay? Ureter is going to where? Urinary bladder. So, at the pelvic-ureteric junction. Second one, when it crosses the pelvic brim. And third one is the intramural part, where it crosses the muscles of urinary bladder. And there are 2 more. One, where it crosses the vas deferens in male, and another one where it crosses by the uterine artery. And that area is 2.5 centimeter above the ischial spine. In the hip bone, there is ischial spine, and 2.5 centimeter above. In male, it is crossed by this ureter is crossed by vas deferens. And in female, it is crossed by uterine artery. Why? Why during the sterilization process in case of male, urinary retention occurs? That's why, because it is at the 2.5 centimeter above, it is crossed by vas deferens, what we have discussed. So that the surgeon ligate, right? The ureter in place of vas deferens. So urinary retention will occur. And also the surgeon, in case of hysterectomy operation, urinary retention occurs. The same way uterine artery crosses. At that level only by the ureter. And in place of uterine artery, this ureter is tied. And that will lead to urinary retention. Same thing. And third thing, during oophorectomy operation, also urinary retention occurs, because at the level of pelvic brim, where it crosses pelvic brim, it is crossed by internal iliac vessel and ovarian artery. And in case of oophorectomy, ovarian artery is tied, and in place of that, ureter is tied by the surgeon. So that operation will also lead to urinary retention. So we have to be very cautious for this operation at that site. What do you mean by water under the bridge? What do you mean by this? So it's a famous mnemonic. Everybody knows about it. Famous mnemonic. What do you mean by water under the bridge? So at the level 2.5 centimeter above the ischial spine, where it crosses by the uterine artery, is the uterine artery above. below. Uterine artery, there is inside blood, and in the ureter there is urine. So water under the bridge. The uterine, the red color signifies the bridge, and this water, urine is the water. So water under the bridge, and it signifies the position, which is very liable to be died during the hysterectomy operation. So that's why that relation is very important, and that's why a mnemonic comes, water under the bridge, which everybody knows. Huh? Now, now the examiner will ask you, what is this? So you have to tell, this is the longitudinal cut section of the kidney. What is this? This lightly stained structure, what is this? So you have to say, this is pyramid. This is pyramid. Peripherally, this is cortex. And after that, this is medulla. Now medulla has got 4 to 5 pyramid. Here is one, this is one. This one is here. 1, 2, 3, 4, 5, 6. 5 to 7 pyramids will be there in the medullary portion. So when examiner will ask you what is this pyramidal structure lightly stained, so you have to say it is pyramid. And what is in the periphery? This is cortex. Okay. Tell me the texture of these two things, the cortex and the pyramid. So you have to say the cortex is granular and darkly stained. ठीक है ना? Granular and darkly stained, whereas the pyramid texture is striated and lightly stained. This you have to tell. Pyramid is lightly stained and striated, having striations, whereas the cortex texture is granular and darkly stained. Okay. Now the examiner will ask you, what is column of Bertini? Yeah, there is invagination of the cortical matter in between the pyramid, in the medullary portion. This is column of Bertini. And what is medullary rays? The part of the pyramid or medulla which is insinuating within the substance of cortex, which is lightly stained. What I have said earlier, the cortex is darkly stained, but in between there is lightly stained structure. This one is lightly stained. Here you can see this is lightly stained. This is nothing but a collecting tubule. ठीक है, दिखाई दे रहा है ना उसमें? This is lightly stained in the cortical matter. This is medullary rays, which is the part of the pyramid or medulla which is insinuating within the cortical substance. Medullary rays, nothing but the collecting tubule. ठीक है, ये बोलना होगा. And now the examiner will ask you, what is renal lobe? So renal lobe is one pyramid plus adjacent cortical matter. This one is renal lobe. And what is renal lobule? One medullary rays plus adjacent cortical matter is the one renal lobule. Renal lobe, pyramid plus adjacent cortical matter. Renal lobule, one medullary ray, and plus adjacent cortical matter is the renal lobule. Tell me the ductal system of kidney. So you have to tell, it is Bowman's capsule. You all know Bowman's capsule, then proximal convoluted tubule, loop of Henle, distal convoluted tubule, then collecting tubule, collecting duct, duct of Bellini, or papillary duct. Then come major calyx, this is major calyx, then minor calyx, then renal pelvis, and then it is continuous as the ureter. Okay? That is the ductal system. Now the examiner may ask that tell me the vascular network, vascular system. Huh? So it starts with the renal artery, one renal artery, then 5 segmental artery. In between the pyramid, there is what I have said. This is one lobe, renal lobe. So in between the pyramid, interlobar artery. In between the two lobe, renal lobe, interlobar artery. Then it becomes arcuate artery. It forms an arch here. So arcuate artery. Then it runs like this. Interlobular artery. Because here is the renal lobule. So interlobular artery. Then it forms afferent arteriole, glomerular capillary, efferent arteriole, and then peritubular capillary plexus in case of cortical nephron, and vasa recta in case of juxtamedullary nephron. Then come stellate vein, retrograde, then interlobular vein, arcuate vein, interlobar vein, segmental vein, and then renal vein. This is the vascular tree inside the kidney. Okay. Now the examiner may ask, what is renal parallelogram or Morrison parallelogram? It is for the superficial landmark. Just post हो ना. For renal parallelogram बहुत इंपॉर्टेंट है, सरफेस मार्किंग ऑफ किडनी. तो इसके लिए क्या करते हैं, C7 से काउंट कर सकते हैं वर्टिब्रा प्रोमिनेंस, या नहीं तो यहाँ पे स्पाइन ऑफ स्कैपुला होता है T2 लेवल पे, ठीक है, वहाँ से काउंट कर सकते हैं. इंफीरियर एंगल ऑफ स्कैपुला T7 के लेवल जो हो सकता है यहाँ पे काउंट कर सकते हैं. यहाँ से भी T12 तक गए, T12 स्पाइन तक गए, और L3 फिर वही स्पाइनस प्रोसेस फिर होता है ना, स्पाइनस प्रोसेस. T12 स्पाइन फिल किए, फिर L1 हो गया, फिर L2 हो गया, L3 हो गया. यहाँ एक मार्क कर दिए ऊपर में, और यहाँ पे एक मार्क कर दिए स्पाइनस प्रोसेस में, ठीक है. अब 2 वर्टिकल एंड 2 हॉरिजॉन्टल लाइन लेना है. तो वर्टिकल लाइन पहला वाला यहाँ से जितना तक मार्क किए हैं, यहाँ 2.5 सेंटीमीटर एकदम पैरेलल ले लेंगे. फिर 9.5 सेंटीमीटर लैटरल जाएंगे, मिड लाइन से 9.5 सेंटीमीटर. ठीक है, बात समझ में आ रही है. 2.5 सेंटीमीटर, फिर 9.5 सेंटीमीटर, और ऊपर में जो यहाँ पे मार्क किए थे वो एकदम हॉरिजॉन्टल कर देंगे, इधर से इधर, इधर से इधर. जो यहाँ पे एक रेक्टेंगल बन जाएगा, दैट इज नोन एज मॉरिसन्स पैरेललोग्राम और रीनल पैरेललोग्राम और मॉरिसन पैरेललोग्राम. ठीक है, तो दैट इज फॉर द. थैंक यू.
9.5 वो मिड लाइन से
ask you why left kidney is suitable for donation. Why? So left renal vein is larger than the right one. Right in the inferior vena cava is towards the right side. So there is short renal vein, and in the left side it is longer. And left one is suitable for donation because after the operation there will be chances of renal vein thrombosis. As it is longer, there will be less chance, and this one is shorter. In the right side, there will be more chance. So left one is suitable for donation. Now very hit VIVA question. Anterior relation of kidney. This is kidney. Anterior relation and the posterior relation of kidney. This is on right side and this is the left kidney. This is right kidney. So in the right side, there is hepatic impression. This is hepatic, but most above is the suprarenal. We all know above the kidney there is suprarenal gland. So this is impression for the suprarenal, then hepatic impression. This is C-shaped duodenum, and then colon, that is large intestine, and jejunal impression. Small is always protected by large. ये हमेशा ही medially रहेगा और ये हमेशा ही laterally. तो ऊपर से हो गया hepatic, most above is the suprarenal, by the side medially duodenum, below and laterally colon, and below and medially jejunal impression. This is anterior relation of right kidney. Now coming to anterior relation of left kidney. This is kidney. Now most above again is the suprarenal. Here is the, in right side there is triangular, but in left side it is semilunar in shape. Okay, very important. First suprarenal, and there is also, after that there is in the periphery, this is spleen. In yellow color this is a splenic impression, and we all know spleen lies on the fundus of stomach. So here is the stomach impression. On the bed of stomach there is pancreas. So this is pancreatic and this is splenic artery. Again on the inferior side laterally colonic and medially jejunal impression. ठीक है? सुप्रारीनल सब एस से है, देखो सुप्रारीनल, स्टमक, स्प्लेनिक आर्टरी, स्प्लीन, 4 एस है. फिर यहाँ पे पैंक्रियास हो गया, स्टमक बेड पे रहता है, सब जान रहे हैं. फिर यहाँ कोलोनिक हो गया, जेजुनल हो गया. ये एंटीरियर रिलेशन हो गया. नाउ अबाउट द पोस्टीरियर रिलेशन, व्हाट वी आर सीइंग हियर इज द स्पेसिमेन ऑफ dissected cadaver. This what we have dissected the posterior abdominal wall, and kidney lies over here, and we are discussing the posterior relation of kidney. So what is there? There are 3 muscles in the vertical fashion. Vertical fashion, 3 muscles: PQT, psoas major, quadratus lumborum, and transversus abdominis. This yellow one, yellow wire, this is above is the iliohypogastric and this one is ilioinguinal nerve. In between the psoas major and quadratus lumborum. इन दोनों का जहाँ जंक्शन हो रहा है देख रही हो, वहीं से निकल रहा है ना. तो ऊपर में iliohypogastric है, ilioinguinal है. और ये ब्लू से जो बनाए हैं, दिस इज मीडियल आर्कुएट लिगामेंट, जो डायफ्राम का वहाँ पे खत्म हो रहा है. मीडियल आर्कुएट लिगामेंट एंड दिस इज लैटरल आर्कुएट लिगामेंट. मीडियल आर्कुएट लिगामेंट इज व्हाट? Is the above condensation of psoas sheath, and lateral arcuate ligament is what? Is the above condensation of sheath over the quadratus lumborum, है ना. तो ये medial and lateral arcuate ligament भी इसके posterior relation में है, and ये muscles vertical fashion में है. iliohypogastric, ilioinguinal निकल रहा है. अब ये क्या है? This is subcostal nerve vessel, है ना. ये L1 होता है सबका रूट वैल्यू, तो इसके ऊपर कौन है? सबकॉस्टल रहेगा. सबकॉस्टल नर्व वेसल्स, T12 का जो होगा नर्व कौन है? सबकॉस्टल नर्व वेसल्स. और क्या होगा? रिब होगा. तो राइट साइड में जो होता है थोड़ा बिलो होता है, तो उसमें सिर्फ 12 रिब होगा, इसमें 11 है 12. तो देख रही हो पोस्टीरियर रिलेशन में दोनों का सेम है. तो यहीं पे वाइवा क्वेश्चन बन जाता है. व्हाट इज द डिफरेंस बिटवीन द पोस्टीरियर रिलेशन ऑफ राइट किडनी एंड लेफ्ट किडनी? So this T11, माने 11th rib. 11th rib will present, the impression of 11th rib will be on left side because it is somewhat higher. है ना, समझ में आ रहा है ना.